The obesity epidemic. Understanding the causes, consequences, and solutions. Obesity is a complex and multifaceted health issue that affects millions of people worldwide. It is a major risk factor for a range of serious health problems, including heart disease, stroke, and type 2 diabetes. In this article, we will explore the causes, consequences, and solutions to the obesity epidemic. What is obesity? Obesity is a condition characterized by an excess amount of body fat. It is typically measured by calculating an individual's body mass index, BMI, which is their weight in kilograms divided by their height in meters squared. A BMI of 30 or higher is considered obese. Causes of obesity. The causes of obesity are complex and multifaceted. Some of the key factors that contribute to obesity include 1. Genetics. Genetic factors can play a role in obesity, as some people may be more prone to weight gain due to their genetic makeup. 2. Poor diet. A diet that is high in calories, sugar, and unhealthy fats can contribute to weight gain and obesity. 3. Lack of physical activity. A sedentary lifestyle can contribute to weight gain and obesity. 4. Environmental factors. Environmental factors, such as the widespread availability of unhealthy foods and the lack of safe spaces for physical activity, can also contribute to obesity. 5. Hormonal imbalances. Hormonal imbalances, such as an underactive thyroid gland, can also contribute to weight gain and obesity. Consequences of obesity. The consequences of obesity can be severe and far-reaching. Some of the key consequences of obesity include 1. Heart disease. Obesity is a major risk factor for heart disease, which is the leading cause of death worldwide. 2. Stroke. Obesity is also a major risk factor for stroke, which can have devastating consequences. 3. Type 2 diabetes. Obesity is a major risk factor for type 2 diabetes, which can have serious consequences if left untreated. 4. Certain types of cancer. Obesity has been linked to an increased risk of certain types of cancer, including breast, colon, and kidney cancer. 5. Mental health problems. Obesity can also have a significant impact on mental health, leading to depression, anxiety, and other mental health problems. Solutions to obesity. The solutions to obesity are complex and multifaceted. Some of the key solutions include 1. Healthy eating. Eating a healthy, balanced diet that is low in calories, sugar, and unhealthy fats can help to promote weight loss and improve overall health. 2. Regular physical activity. Engaging in regular physical activity, such as walking, running, or swimming, can help to promote weight loss and improve overall health. 3. Environmental changes. Making environmental changes, such as increasing access to healthy foods and safe spaces for physical activity, can also help to promote weight loss and improve overall health. 4. Medications and surgery. In some cases, medications or surgery may be necessary to help promote weight loss and improve overall health. Prevention and treatment of obesity. Preventing and treating obesity requires a comprehensive approach that includes a combination of healthy eating, regular physical activity, and environmental changes. Some of the key strategies for preventing and treating obesity include: 1. Setting realistic goals. Setting realistic goals, such as losing 1 to 2 pounds per week, can help to promote weight loss and improve overall health. 2. Keeping a food diary. Keeping a food diary can help to track eating habits and identify areas for improvement. 3. Getting support. Getting support from friends, family, or a healthcare professional can help to promote weight loss and improve overall health. 4. Staying hydrated. Staying hydrated by drinking plenty of water can help to promote weight loss and improve overall health. Conclusion: obesity is a complex and multifaceted health issue that affects millions of people worldwide. By understanding the causes, consequences, and solutions to obesity, we can work towards preventing and treating this condition. By making healthy lifestyle choices, such as eating a healthy diet and engaging in regular physical activity, we can promote weight loss and improve overall health. Recommendations: if you are struggling with obesity, here are some recommendations to get you started. 1. Consult with a healthcare professional. Consult with a healthcare professional to determine the best course of treatment for your individual needs. 2. Set realistic goals. Set realistic goals, such as losing 1 to 2 pounds per week, to promote weight loss and improve overall health. 3. Keep a food diary. Keep a food diary to track eating habits and identify areas for improvement. 4. Get support. Get support from friends, family, or a healthcare professional to promote weight loss and improve overall health. 5. Stay hydrated. Stay hydrated by drinking plenty of water to promote weight loss and improve overall health.